Good afternoon. My name is Paula Hernandez and I'm Food Project and Policy Officer at Healthcare.Harm Europe. For those who are not familiar with Healthcare.Harm Europe, we are a non-for-profit membership organization of European hospitals, healthcare systems, healthcare professionals, local authorities, research and academic institutions, and environmental and health organizations that brings the voice of healthcare professionals to the European policy debate on diverse topics. And we also raise awareness and inform the healthcare sector about the importance of the environment and press healthcare leaders and professionals to advocate for broader societal policies and changes. As I previously mentioned, in the European office, we work on several policy areas, mainly the impact of pharmaceuticals on the environment and antimicrobial resistance, climate-smart healthcare, the importance of access to healthy and sustainable food services while reducing food waste, safe management of chemicals, and sustainable procurement. We work on these areas closely with our diverse network of more than 100 members across the European region. But this is all part of the global network of green and healthy hospitals, which is made of more than 1,450 members representing 43,000 hospitals and healthcare facilities worldwide. I will strongly encourage all the participants to join this community if you are not part of it yet. I'm really happy to be here, and I will be presenting today one of the projects in which Healthcare.Harm Europe has been involved in the past 3 years, and me personally, I've been responsible of delivering. The MECA project, for its acronym in French, Modèle d'économie circulaire au Hôpital français, was developed by us, Healthcare.Harm Europe, in collaboration with the Hospital of New York in France, with the aim to tackle food waste and reinvest savings into the local economy through the purchase of more local and organic products, as well as raise awareness about food waste among patients and health professionals. Through this project, the hospital has 3 main objectives: develop and implement a circular economy model for food, analyze and reduce food waste at the hospital by 20% in 3 years, and purchase more local and organic products as part of their overall procurement by at least 10%. To this purpose, the main project activities we have conducted are the following ones: develop a preliminary patient and staff survey about hospital food services, measure the quantity of food waste post-consumption in both the kitchen, cafeteria, and some departments, analyze hospital purchases, assessing which products can be substituted to gradually move towards more fresh, local, and organic food, identify and engage with a network of local and organic farmers, evaluate progress and identify opportunities to scale up initiatives to other institutions across France and Europe. A starting point of this project was the lack of available information and data about food procurement and food waste, specifically within the healthcare sector. There is little information available about the cost or benefits of transitioning towards a circular economy. What is known, however, is that the European healthcare sector has massive purchasing power. Moreover, the sector accounts for approximately 8% of workforce and 10% of the GDP in Europe. And now let's take a closer look to our first activity and of the food service at the Hospital of New York through a video like we have produced.
l'UCPA, c'est l'unité centrale de production alimentaire qui produit pour l'ensemble de l'hôpital de Niort, pour les 1300 lits. La cuisine centrale de l'hôpital de Niort produit 700 000 repas par an pour les patients et résidents et 130 000 repas pour les professionnels de santé, ce qui représente une production moyenne de 3200 repas par jour. Pour les professionnels de santé, nous avons déjà proposé des produits locaux, pommes, poires, mais aussi des produits laitiers.
So, as you have seen, the Hospital of Niort serves on average 300 to 100 meals per day and have a budget of 1.9 million euros. From the first activity and the survey we did to both patients and employees about their perception and satisfaction of the food services, we got overall positive responses. They appreciate in general dairy products and pastries, while cereals and potatoes go usually to waste, particularly at dinner times. I could talk further about the results of this survey, but I'm happy to respond later to your questions if needed. According to these results, the Hospital of Niort designed an action plan that translated into the development of 2 menu rotations to take advantage of what is in season, helping to keep products fresh, reduce waste, and appeal to a larger number of patients. They also held multiple meetings with organized producers in the area. Therefore, the hospital has put in place as well different measures to restructure its food service, and therefore increase the quality of food delivery by communicating better between kitchen staff and work staff, increase creativity and better presentation of dishes by testing as well new recipes and products and substituting single-use plastic according to the French and European legislation. Let's see some of the videos we have produced as well with some of the producers. This one is producer of apples and pears.
Je suis Christophe Proto, donc les vergers des Rios à Secondigny. Je suis en agriculture biologique à 100% bio depuis 2020 et ma première conversion est en 2015. Alors là, vous êtes entre 2 rangées de pommiers, hein, donc des variétés, la variété clochard, donc une variété locale de chez nous, donc qui est une variété rustique qui convient très très bien en agriculture biologique. Aujourd'hui, pour moi, travailler localement avec l'hôpital de Niort, c'est une aubaine. Je fournis pas mal de collectivités sur la région parisienne ou sur la région de Grenoble. Du coup, si on peut diminuer un peu ces volumes et les envoyer sur notre territoire à proximité de chez moi, c'est l'idéal. Région un peu arboricole en pommes et en poires, on a largement la capacité à fournir l'hôpital de Niort et voire d'autres hôpitaux.
I'm not gonna show all the videos, but as I included in the chat, all of them are available in our YouTube channel. Regarding the second action and activity about the measurement, it was done in different areas of the hospital, both the kitchen, the canteen, and some wards, such as psychiatric ward and maternity ward, as well as the general hospital. And samples were taken for analysis, and they were divided into household waste, recyclable waste, and bio-waste. The results we obtained from the comparison of waste generated in 2018 and 2020 show that there has been a reduction in some waste categories, particularly in recycle, from 29% to 23%, and bio-waste from 35% to 27%, particularly in the central food production unit. This reduction in part is thanks to the increased training and awareness, as well as better portion controls. However, household waste increased from 35% to 48%, and within this can be explained by the exceptional circumstances as well of the COVID pandemic, like we are still on, and associated increase in single-use plastic, like as masks, clothes, food trays, etc. From this activity, we have actually developed one of the tools of the project to measure food waste resulting from food services. This tool was created from the specific case of the Hospital of New York with the idea to extend it to other hospitals. The software is currently on a beta version, only available in French, but I'm gonna show it to you now. It's pretty simple and easy to use, and the idea is like we are gonna test it and translate it to other languages. It allows user to enter data such as number of meals cooked, its year, the cost price of raw materials, staff, investment, and energy consumption, the average weight, the volume of waste, and the cost of its removal. So I'm gonna change now to share the tool. Find it. Yeah. Okay, so this is the tool as you see it, as I said, in the beta version. You can find here the food waste measurement tool, and I will talk later on as well about this one. So let's get first a look to the food waste measurement. So we are gonna do a first simulation. We are gonna say like, let's do it mostly from last year. If we can. So 01/2020 to January this year, as an example. So next. The number of meals at the Hospital of New York that we have seen is 830,000. The cost is 4.7 euros at the Hospital of New York. And the average weight of this is 550 grams. Here it is shown in more detail the method we have used for those who want to go further. Price, for example, has been taken, as I said, into account the cost of food purchases, the salary of kitchen staff, energy and investment regarding equipment, if I remember correctly. So let's go next. Here, the volume as well, it's for the case of the Hospital of New York, this has been from the audits as well we have done. This data, in which the share of food waste represented around 25% of the overall volume of household waste. And as well, it indicates that without any particular action, 70% of this waste can go to waste. So here the cost would be this. Once you also include even your own values from the different measurements you do, you just have to click here and it will basically say like the cost of your food waste in this case is around 1,000 euros, which is kind of the equivalent to 264,458 meals, approximately. Sorry, this was 1 million euros. So right now, what this tool also allow you, if you are willing to use this tool, is to simulate and compare different scenarios. So here you can see mostly what we have introduced. And now let's add another simulation. We are gonna call it now, for example, in 2021, as this is mostly from 2020. Sorry, so in 2020, yeah, let's say we are gonna reduce this volume to 100, for example. So here, automatically, we can see as well what it represents in terms of not only this category, but also overall, in terms of grams per meal, in euros, and also a number of meals. You can see the comparison with the first one. We can add other simulation. Let's call this one 2021. We are going to reduce even more here the volume. And we can see for the moment as well kind of a comparison with the first simulation we have done, but we can also compare with the previous one here. So let's say like in comparison with this, the reduction will be just 10%. We can add as many simulations as we want. Let's say as well, we kind of reduce the number of meals we produce. In general, as I said, this is gonna compare now with the previous one. With the first one, but we can also compare them within the previous one. And we can change the order as much as we want. So I think this is mostly all regarding this tool. And yeah, it's a matter of experimenting with your own data as well and see which variables can be more adaptable to your own services as well and needs. I'm not sure. It really depends, it's case by case. I don't see any questions for now, so I'm gonna continue. Here, this is mostly adapted for France, but as I said, well, we are still restructuring this tool. We will add more materials. So let's go back to the beginning to explain the second tool we have developed to measure the carbon impact of food purchases of the Hospital of New York, taking into account as well the database that is available in France from the Agency for Ecologic Transition. This tool has been integrated with the one previously shown because initially they were separated, but we have decided to put it all in the same program. So let's go down. I'm gonna start a new one. Basically this one, it allows you to include all the quantities of food types that you have in your hospital. It divides them into drinks, fruits, vegetables, cereals, meat, fish. So yeah, different ones like dairy products, some prepared food, legume, pulses, etc. So we are going to try to do a little test because yeah, let's imagine, for example, we buy carrots. So for the moment, this is conventional carrot, but you also have organic carrot. And so, okay, well, I'm gonna take first the other one. So let's imagine we buy 25 kilos of carrots by 4.8 euros from the rest of Europe, for example. It can be whatever, Germany, Russia. So we just pressed OK, and we can see already here some calculations on kilograms for CO2. We will see later on as well more, and I'm gonna just add more food ingredients so we can get as well more data. This is 12 kilograms by 28 euro by 12 euros, and this is coming from France. Now let's include as well some bread, which is really typical everywhere. We are going to buy 12 by 1 euro. And this is also coming from France. We are going to add as well some lentils to add some plant-based protein. So here it will be 20 kilograms, 6 euros, and this is coming as well from Europe, for example, even though France has a new strategy for plant-based protein. So we can start seeing here already what we are introducing, and also in the table below. Let's add, for example, as a last element for now, some spinaches. So it will be 10 kilos by 2, and the origin is rest of the world, let's say international. Okay, so yeah, this you can, for example, here you make a mistake, you can always change it afterwards as well. Here you can see, as I said before, kind of the equivalent on CO2 emissions. We are still refining this, so don't get too scared. And here as well, kind of like in terms of euros as well, what you have spent for each food category. Here you can see more like a model, like in a chart, so it's more visual. You can create, as in other cases, different comparisons. I'm going to try to add here, yeah, another one. Sorry, maybe, okay. I'm just maybe copy paste this one. But let's say that instead of agneau, I want to substitute as well my agneau by chickpeas. So washish French, and we are going to add 20 kilos by 1.5 euros, and the origin is France. So you can put here, for example, yeah, the plant-based, let's say. Here, as in the other one, you can see as well a comparison even in terms of CO2 emissions, but also in terms of, yeah, for example, we are not spending so much on meat, but we are spending more on pulses. So we see still like we are okay. So we can also play with this for the budget of your own establishment. Let's add here, sorry, I'm always making the same mistake. So basically here, let's say I want to convert all of this, but more in local. So let's change all the products so they come as well from Europe, so from France, sorry, at least. So here as well, we see a comparison, not only with previous one, as in the previous case of food waste, but you can also compare with this one. So here we see a reduction as well on fruit and vegetables because of the spinaches and the carrots, and also in terms of the lentils. As an example. Yeah, you can also compare, as I said, in terms of euros and even in the chart. So you see here, for example, a comparison. I can see there is a raised hand that if you don't mind, Michelle, to type your question on the chat box, or I will give you the word later on. Okay, I think this is all in terms of as well the tool. So I'm gonna come back to the presentation. And then I will be happy to answer to all your questions. Okay, the last activity in terms of communication, all materials of the project can be found in our website, foodforhealthcare.org. It's available both in English and French, and you can find many case studies as well. Here you see as well some of their resources. We have been producing different webinars which have been organized in French. But we have also report in French from the first conference we did, and this other report it's going to be available from tomorrow on both our website of Health Good at Home Europe and Food for Healthcare, both in English, French, and Spanish. And this last report summarizes the whole project. And there's still much more to come, as we got as well an extension for this year to communicate and disseminate our results. And as I said, test these tools I mentioned quickly in other French and European hospitals. To conclude, I would like to remind us all that the healthcare sector is uniquely positioned to properly marry agriculture, health, and environmental goals, and to contribute to the debate on how to address tomorrow's food challenges, including reducing food waste. Through their purchasing decisions, healthcare providers can invest in sustainable agriculture and can act as powerful advocates for action on public policy to build healthy and sustainable food systems. By implementing healthy and sustainable food strategies, healthcare providers can improve public and environmental health and to begin to address socioeconomic disparities that exist within our communities. With this pilot project, we have demonstrated that catering services in healthcare can play an important role in making food a fundamental part of patient and staff satisfaction within healthcare services, as well as reducing the environmental impact of hospitals. The project has also shown us that involving a wide range of stakeholders, such as patients and local and organic farmers, is essential in developing and implementing sustainable food strategies within hospitals, helping to prevent and reduce food waste. It is important to involve healthcare professionals and other hospital staff through training and awareness raising. With projects like this, it is possible to change the way patients and employees eat and think about hospital food. As a summary, and while I collect your questions, let's watch the final video that we have made to summarize the project. Thank you.
Le centre hospitalier de Niort a engagé une démarche de développement durable depuis plus de 10 ans, qui a conduit notamment à faire à plusieurs reprises un bilan carbone pour mesurer nos progrès. Le projet de lutte contre le gaspillage alimentaire en est la nouvelle traduction depuis 2018.
Aujourd'hui dans les hôpitaux, il y a des chiffres qui sont sur le gaspillage alimentaire et c'est plusieurs centaines de grammes par repas par jour. Donc voilà, il faut qu'on regarde ce que vous jetez, ce qui se jette, qu'est-ce qui peut être trié, qu'est-ce qui peut être donné à d'autres solutions. Est-ce que demain ça ira sur une forme de compostage? Voilà, il faut qu'on étudie toutes ces solutions.
L'idée c'est bien de faire avec vous et pas de vous imposer les choses. Bernard a expliqué qu'on allait effectivement commencer par une étape qui est un état des lieux, un diagnostic. Donc quantifier le gaspillage alimentaire qui se produit au sein de l'hôpital sur différents services. Donc pour ça on va faire notamment des pesées.
L'étude que nous avons menée en 2018 a montré que sur l'ensemble de nos déchets, 30% étaient des déchets fermenticibles. En 2020, une nouvelle étude a été menée pour voir l'évolution de la part des déchets fermenticibles dans l'ensemble de nos déchets. Avec nos partenaires, nous avons imaginé 2 outils. Un pour mieux appréhender le coût du gaspillage et un second pour mesurer l'impact en termes de rejet carbone.
L'outil se veut très interactif, très simple. Une fois qu'on a réalisé son audit, l'objectif c'est bien de créer des simulations qui vont permettre de comparer et simuler des changements dans nos pratiques. Ça va être surtout de simuler par exemple un changement de pratique en baissant le volume de gaspillage alimentaire, ce qui va pouvoir tout de suite nous donner le coût et le volume économisé ainsi. Cet outil, c'est vraiment un tout petit maillon de toute la chaîne. C'est pas du tout, il n'y a pas une vocation à être la finalité, parce que la finalité c'est bien des changements de pratique sur le terrain.
La cuisine centrale de l'hôpital de Niort produit 700 000 repas par an pour les patients et résidents et 130 000 repas pour les professionnels de santé, ce qui représente une production moyenne de 3 200 repas par jour. La nouvelle offre alimentaire sera mise en place début novembre. Elle a comme objectif une meilleure prestation, plus de production maison et moins de déchets alimentaires. Dans le cadre du respect de la loi Egalim, nous avons rencontré les producteurs locaux pour pouvoir les intégrer dans la nouvelle offre alimentaire.
Aujourd'hui, pour moi, travailler localement avec l'hôpital de Niort, c'est une aubaine parce que je fournis pas mal de collectivités sur la région parisienne ou sur la région de Grenoble. Si on peut vendre mes produits au sein du département ou à proximité de chez moi, c'est l'idéal.
C'est important sur un territoire de remettre de la connexion entre des productions locales avec un savoir-faire et des acteurs du territoire qui sont donc des consommateurs ou des collectivités. Je pense que l'histoire, elle est vertueuse et belle à écrire, quoi. Quand on parle d'hôpital, aujourd'hui, je pense qu'on parle de santé. Quand on parle d'alimentation, être en phase avec une alimentation santé, je pense que c'est une approche qui doit prendre tout son sens, quoi.
Je pense qu'il faut saluer la démarche de Niort, qui est une démarche pertinente. La meilleure preuve, c'est qu'elle est suivie par beaucoup d'hôpitaux sur le mode volontaire.
Le constat que je fais aujourd'hui de mes diagnostics que je viens de finir à la fin mai, le gaspillage alimentaire est un levier qui, parmi tant d'autres, pour revenir à l'achat vertueux et durable dans le cadre de la loi alimentation.
On l'a vu à travers tous les projets qui ont été exposés, on ne peut plus, on ne doit plus mener de projet sans intégrer la dimension alimentation durable.
Quand on s'attaque à la restauration collective en milieu hospitalier, on est très ambitieux. Quand on montre qu'on est capable de le faire en milieu hospitalier, eh bien, on doit être capable de le faire dans des conditions où il y a des moins de contraintes, en milieu scolaire ou dans d'autres types de restauration collective. Donc attaquer le sujet par le haut au niveau de l'hôpital me semble devoir être salué.
Okay, well, thank you a lot for listening. And now I'm getting some questions from you, so I'm gonna pass responding them. I'm aware that the chat is unavailable for you, but you can see at the bottom as well of your screens a Q&A button, so there you can type as well your questions. So I'm not available neither to give you the word and be able to let you talk, even though I would love to have a conversation with all of you. So, well, the first question is actually coming from David Brasville. Hello. He is asking if do we have any examples of hospitals setting a specific quantified goals for increasing the amount of plant-based nutrition? How are those goals expressed? Is it simply to reduce the use of certain animal-based food sources? So I know some examples of hospitals who are setting some goals or targets in that direction, mostly to reduce as well their CO2 carbon footprint from procurement processes. There are some in UK, but also, for example, Austria. For the moment, I would say it's mostly more typical of the Nordic countries, also because the dietary guidelines are accompanying a lot these decisions. And also, how as well at the national level is setting these goals. I'm still not sure how these goals will be expressed. As I said, it's mostly through procurement processes. It's mostly, for the moment, as I've been reading, it's mostly to reduce meat products. They are not focusing much on fish or other related products, more from the ocean or rivers. So it's mostly based on meat and dairy products as well in most of the cases, but not exclusively, as it also depends a lot on country by country and the cultural preferences they have as well. In the case of the Hospital of New York, I know it's mostly related as well with meat products, but not so much on dairy products, because as from the results as well of the survey, for example, dairy products was one of the most popular items. So yeah, I hope I replied to your question. Otherwise, please don't hesitate to ask further. Thank you as well, Amy Johnston, for your question. So I know your internet cut for some minutes, and you are asking which actions were done to reduce the amount of food that was wasted. So I'm going to answer first this one. So it's been mostly through training and raise awareness among staff and also visitors and patients. Visitors mostly refer as well to students in the canteen. That was shown mostly during the first 2 years. Last year was a bit complicated because of the pandemic, but a lot of flyers, posters, even some of the students were involved in the project in some way, measuring food waste, and realize how much food waste was generated in the canteen or at the in the general hospital. Also, there were the hospital put in measure as well some strategies as controlling portioning, because they realized as well at some point there was a lot of food wasted, mostly because they were overproducing due to sometimes as well not good communication or not enough communication between the kitchen and the wards, involving personnel, so the employees. So that was as well something they work on. And I know as well they are nowadays as well restructuring as well some of the food services they have to also reduce some variables that might influence in the process of eating the food, like temperature is one of the variables that patients appreciate the most when food arrives at their own rooms, but it can be as well the aesthetic behind. So they are still working on different strategies to reduce the food waste, and through the tool as well, because at the beginning as well they didn't know how much food waste they had. So through the tool and the different audits, they have realized as well more of that. Regarding your second question about the simulation is the theory and can be useful, that what happened on the ground. Well, this tool, as I said, it was mostly created through their experience. So they have taken really seriously, and the purpose as well of this is like they can change at least in the theory what they want to do, but then they apply it in the practical level and see which results they have, so they can as well play on what is working best or what should need further modification. So also an advantage of this tool, as I've been shown, is like it's really interactive, and the purpose as well of this tool, the creation of it was mostly because the Hospital of New York is kind of considered as well a small, medium-sized hospital. So they don't have all the resources to buy some tools that are already in the market, and that sometimes can be too expensive. So this tool as well, the purpose is like it will be for free, and that's why it's so as well easy to use. It's really a straightforward process. I hope I replied to your question. I don't see any other questions from now. I know, yeah, Michelle, Marx, you are still with your hand raised. Please, if you are interested in learning more about this project, or you feel like you can help test as well this software developed to calculate the carbon footprint of food waste at your hospital, please don't hesitate to contact Europe at HCWH.org, or you can also contact myself personally, which is Paula.Hernandez at HCWH.org. Okay. If yeah, you don't have any other questions, as I said, please don't hesitate to reach us. We will be happy to help, and that counts as well for any questions you might have. But otherwise, I will close this webinar. I really thank you for participating and all your questions and all your attention. So yeah, hopefully we'll see you as well next month. I'm gonna hold another webinar, not so much focused on food waste, but on sustainable food in general. So I hope to see you there as well. Thank you very much. Have a nice rest of the day.